Lower it. Testing. Test, test, test one, test, test. Testing. You good? Testing, test, 1, 2, test, test. You're good? Okay.
It's wonderful to see everyone. We'll get started in about 5 minutes, okay? You want to help me? Oh, you got something to say.
I was officially told I'm not allowed to sing it, and it seems like nope, you're singing shit today. Nancy gave me specific instructions. She's like, you're just gonna stand today and do what all the other executive directors want for the program. I said, okay, está bien, está bien. I said, I'll follow directions for once in my life.
That is too cute. That is too cute. Hello, Dr. Perez. Good morning, good people. If everyone can settle so we can begin our program. Thank you all. Thank you all for showing up today. And thank you all for joining us today on this very momentous occasion. Official launch of the LA County Department of Public Health's Office of Worker Health and Safety. I'm going to begin with a land acknowledgement on behalf of the county. The County of Los Angeles recognizes that we occupied land originally and still inhabited and cared for by the Tongva, Tataviam, Serrano, Kiz, and Chumash peoples. We honor and pay respects to their elders, descendants, past, present, and emerging, as they continue their stewardship of these lands and waters. We acknowledge settler colonialism resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevating these stories. Culture, community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native peoples and local tribal governments, including, and in no particular order, the Fernando Tataviam Band Indians, the Gabriano Tongva Indians of the California Tribal Council, the Grabiel, Grabieleño Tongva San Gabriel Band of Mission Indians, the Grabieleño Band of Mission Indians of the Kiz Nation, the San Manuel Band of Mission Indians, the San Fernando Band of Mission Indians. So yeah, we honor their memory and their work and their struggle as we move forward. My name is Cipriano Belser. I'm the co-executive director of Southern California Coalition for Occupational Safety and Health, also known as SoCalCosh. And I'll be your MC for today. At SoCalCosh, we advocate for safe, healthy, and secure jobs for all workers, and we aim to disrupt the root causes of work-related injuries, illnesses, fatalities through coalition building, direct action, education, and leadership development across California. Today, I'll also be joined by Kevin Riley, director of the UCLA Labor Occupational Safety and Health Program, also known as UCLA LOSH, who will help me close out today's event, along with the director of LA County Department of Public Health, Dr. Ferrer, representatives of the LA County Board of Supervisors, LA City Council members and worker allies, Imelda Padilla and Hugo Soto Martinez, and with representatives from the worker organizations who will share about their work and their role in the Public Health Council's program over the year and issues that we face as workers in this county. Together, as leaders of the occupational safety and health movement in Southern California, we are committed to ensuring all working people can go to work without worrying about conditions impacting their long-term health and well-being, making sure that they can get paid livable wages and just wages, that they can speak up without fear of retaliation. And we see this new office as an important step in realizing that vision and bringing it to action. At the foundation of the Office of Worker Health and Safety are the organizations, and that's y'all, right? Those of you who respond, yeah, give yourselves a hand. You know, we have presented here organizations that responded to the Woolsey fire of 2018, right, to ensure that workers who were cleaning the debris were protected and had the education. You know, we have organizations here who fought hard to pass and implement the Public Health Council's program to support workers who are navigating COVID-19 and those outbreaks across the low-wage workers in high-hazard workplaces here in LA County. Those of you who worked to develop the Silicosis Prevention Initiative to support and educate workers in the engineered stone industry who are getting sick with silicosis, right? A deadly disease that's been impacting workers at alarming rates here in our county. Organizations who distributed N95 respirators and Know Your Rights resources to workers within 24 hours of the historic Eaton and Palisades fires. And those who will continue to fight for the health, safety, and justice for all the workers in our county. As the first office of its kind in the U.S., in the nation, we see this new office paving the way for other local health jurisdictions to prioritize worker health, safety, and well-being. I have had the privilege of working closely with DPH since the start of the Public Health Council's program. And we're incredibly optimistic about the positive impact that the Office of Worker Health and Safety can have, right? That connection, right? That support between the worker advocates and the offices of enforcement, right? So it's very moving for me to see, you know, representatives from the press, our worker leaders, the worker centers, the community-based organizations here, unions, our government partners, and all advocates that are gathered here today. We are all united in a common goal to protect the health, safety, and fundamental dignity of every worker in Los Angeles County. LA County has a vibrant workforce, but our workers are disproportionately burdened by high rates of occupational injuries, illnesses, wage theft, and retaliation. So this situation demands action. And that action is taking shape today with the launch of the office. It's a direct response and focused effort to protect and empower our workforce in LA County. And now, it is my pleasure to introduce the Director of the Office of Worker Health and Safety, Alice Berliner.
Hi, everyone. It's so good to see you and so appreciate everyone coming out today. My name is Alice Berliner, and I am the director of our Office of Worker Health and Safety. Words cannot express my excitement and gratitude to be standing here today amongst friends, allies, and leaders to make it clear that we stand with working people in the wake of disasters in the midst of attacks on our communities, and we are committed to building an infrastructure that is a reflection of what workers in this county need, and to make it known that the Office of Worker Health and Safety is open for business. I am humbled to build this office and community with all of you and to join the incredible Office of Worker Health and Safety team who have been the people working hand in hand with our community and labor partners to develop the Public Health Council program over the last 4 years. And now it is an honor to introduce our Director of LA County Department of Public Health, Dr. Barbara Ferrer. Dr. Ferrer is a dedicated and compassionate advocate for working people and vulnerable communities in the county and across the country. Some may not know this, but Dr. Ferrer worked as a community organizer early in her career and knows firsthand how integral organizations like the ones here today are to the success of an office like this. In one of our first meetings last May, she said that we needed to look to labor and the workers' rights movement here in LA to inform our future programs and priorities. And it is because of Dr. Ferrer's leadership and vision for advancing safe and healthy workplaces for all that this office was established. Help me in welcoming Dr. Barbara Ferrer.
Buenos dias, good afternoon. Well, actually, good morning todavía. So, good morning, everyone. Thank you so much, Alice, for the kind introduction. And I want to thank the folks at the Zev Yaroslavsky Center for inviting us and allowing us to be here today as we're kicking off National Public Health Week and we're celebrating the launch of the Office of Worker Health and Safety. I do want to take a minute to call out by name the organizations that are supporting this work. As you know, there is nothing we do in public health that we do by ourselves. So we have so many partners here today, and I want to just take a moment to ask that folks stand up or put their hands up so that you recognize the leadership that's in the house with us today, because it's fabulous to be able to work collectively with so many. I want to start with the office of our County Supervisor, Lindsay Horvath, and thank the team from that office and the supervisor for everything they were doing to support worker health and safety and public health. I also want to acknowledge how honored I am to have two of our city councilors with us today. Council member Imelda Padilla, 6th Council District, and Council member Hugo Soto Martinez, my city councilor from the 13th Council District. I also hope that the access to prevention, advocacy, intervention, and treatment folks, could they just put their hands up, and they're in the house with us. Yay, thank you guys. So nice to see you. The California Healthy Nail Salon Collaborative. So yay, thank you guys. We've got the Clean Car Wash Worker Center. You guys could all stand. Woo! You know, the Filipino Migrant Center folks. I know I saw you guys earlier. Instituto de Educación Popular del Sur de California. Thank you guys. Koreatown Immigrant Workers Alliance, really founding members with us. Pacoima, beautiful, can't say enough. So you guys have been with us for years now. So muchas gracias por todo. The Philippine Workers Center, thank you. The Restaurant Opportunity Center of Los Angeles. The Ricardo y Casa Workers Center, the Thai Community Development Center, the Garment Worker Center, the Los Angeles Alliance for a New Economy, the Warehouse Worker Resource Center, our partner at UCLA from the beginning of our work on worker rights, UCLA Labor Occupational Safety and Health Program. Thank you, folks. And the Southern California Coalition for Occupational Safety and Health. So I wanted to take the time to name everybody because this is the movement. And most of you have been here long before us. Fighting for essential rights for people who do essential work and keep us all alive and functional. So my heart is with all of you. I want to particularly acknowledge the workers who took time off from work to be with us today. Muchas gracias por todo. I know that this is a community that's powerful and is going to make enormous changes to ensure health and safety for all of our workers. I also want to express my gratitude and for the leadership from Alice and her team. So if the folks from the Office of Worker Health and Safety could put their hands up. They're amazing. It's such a small group, pero ellos hacen un trabajo tremendo. They work so hard. So I'm so grateful for all of their support and their leadership. And I'm really excited, as I know so many of our colleagues are, to commemorate National Public Health Week. But I do want to note that this celebration comes at an extremely challenging time for our agency and our partners locally and nationally. The work we do in public health, make no mistake, is nonpartisan, and it's focused on the well-being of our entire population and communities. Despite that, our ability to protect residents and workers has been threatened by massive proposed budget cuts from the federal government. 2 weeks ago, we were notified that more than $45 million in previously awarded grant funds, much of which was intended to last through July of 2026, was rescinded without notice. We were also noticed by the state that a portion of the county's immunization dollars and substance abuse prevention funds that come initially from the federal government were also terminated mid-contract by the federal government. These are unprecedented actions, and the funds that are terminated are foundational to our public health infrastructure and our prevention efforts. And while a federal court granted a temporary restraining order late last week, which means that funding for these programs can continue at least until our court hearing on April 16th, the new administration has an intent to move swiftly to dismantle existing programs and that fly in the face of our country's values. Coupled with the termination of thousands of federal employees at the federal health agencies, including the Centers for Disease Control, our national public health department, we are worried that the new administration is not understanding the essential and critical importance of public health efforts. Given that LA County is a national epicenter for travel, trade, and demographic diversity, public health efforts that ensure that residents and workers have the resources to protect from emerging and re-emerging infectious diseases, environmental hazards, workplace disruptions, and chronic diseases make economic sense and moral sense. Sadly, abrupt cuts to critical funding and disinvestments in national public health capacity can have a real impact on the health and well-being of residents, workers, families, and our communities. In the months ahead, we are going to need to continue to work collectively with all of our partners to uphold a public health mission, to advance the conditions that support optimal health and well-being for all residents of LA County. One of the clearest lessons that we learned during the pandemic was the need to focus more efforts on protecting workers. A lot of the disproportionality in deaths and severe illness from COVID-19, the fact that people, Black and brown people, and people living in our neighborhoods with the least amount of income were somewhere between 1.5 and 4 times more likely to die or suffer from severe hospitalizations, occurred because many of our essential workers continue to show up every single day at workplaces where they experience significant exposures to a deadly virus without adequate protections. We should never let this happen again. LA County is home to a hardworking workforce that significantly contributes to our economy and our nation's economy. However, we also face significant challenges in safeguarding the health and safety of our workers. LA County experiences some of the highest rates of occupational injuries and illnesses. In 2023, LA County accounted for 25% of all reported occupational injuries in California, This is the highest rate in the state. As of March of 2025, California has recorded 259 cases of silicosis, a severe and irreversible occupational lung disease that's caused by silica dust exposure. LA County bears a significant burden, accounting for 58% of these cases. An 82% increase in LA County cases has occurred since April 2024, highlighting a rapidly escalating crisis. Of those cases, 99% are Latino male workers, with a concentration in the San Fernando Valley. The industries most affected by occupational health and safety violations and preventable hazards include garment manufacturing, warehousing, food service, construction, car wash, and engineered stone fabrication. In our commitment to equity and the protection of all workers in LA County, the Department of Public Health is proud to launch the Office of Worker Health and Safety, which builds on the success of the Public Health Council's program that was launched during the COVID-19 pandemic to protect frontline workers. During the pandemic, the certified worker organizations and public health councils were critical to our efforts to reach low-wage workers to ensure that they had information that was accurate, accessible, and in their language about how to stay safe amid rising workplace outbreaks. Additionally, workers received support from trusted organizations in navigating workplace violations and filing complaints with appropriate agencies. Also, they support accessing PPE, testing resources, and vaccinations. Over the course of the program, it's become clear how important partnerships with trusted organizations are when we're reaching vulnerable resources with the resources that they're going to need to be safe. The recent wildfires are another example where through the network of organizations, we were able to distribute N95 masks and Know Your Rights resources directly to workers, particularly workers that were working in homes on the cleanup, so that they could, in fact, again, have safety as they did their work to help with the recovery. Looking ahead, I do think that this office will play an integral role in close partnership with all of you, our community and labor partners, and our elected officials in navigating current and emerging public health threats, natural disasters, and other systemic issues that prevent all workers from accessing safe and fair workplaces and living healthy lives. Thank you again for the tremendous work, and I'm looking forward to all of the partnerships. Now I'm going to turn the program back to our amazing MC, Cipriano. Muchas gracias.
Thank you so much, Dr. Ferrer. As you shared, addressing labor exploitation is fundamental to public health. The foundation of the Office of Worker Health and Safety is its deep partnerships with community organizations. You guys are the front lines, working directly with workers every single day. So now we're going to hear from local leaders, first beginning with LA City Council member Imelda Padilla, representing City District 6. A lifelong resident of the Valley, Imelda brings over 20 years of community organizing experience and advocacy to City Hall. Prior to joining the council, Imelda served her community in multiple capacities. She helped build the LA County's Women's and Girls Initiative. She worked with the Los Angeles Alliance for a New Economy. She mobilized the Valley Coalition to raise the minimum wage, and she led multiple projects to advance environmental justice here with Pacoima Beautiful. Welcome, Imelda.
Hello, well, good morning, everyone. You know, I gotta admit, before I even get to the more formal part of my speech, I just have so much going on in my mind, being back in this building and being around individuals and all workers that fight for worker justice. I do want to start off by congratulating Alice for this new role. You have worked so hard, and your work is, to me, the epitome of how these sort of things, you know, get established, right? You have the community groups that show that there's an issue, you elevate it to government, the government does everything related to doing the reports and the questioning, and everything related to community has elevated, and then you build up that qualitative as well as quantitative information that shows the need, and then you formalize it. You start the department and then you grow it. But it's a process, and you have always been in those trenches, so I don't think they could have chosen a better director. And I thank you, and I also thank you for always believing in me too and showing me respect, because you've definitely always been someone that has, and I appreciate that very much. Also, to Dr. Barbara Ferrer, it's very nice to see you again. I was still at the county myself when the pandemic first hit. And I always said, if we would have listened to the woman in charge, the woman expert, we probably wouldn't have had those humps go in the summer. But it was a lot of the men that were in charge at the time that insisted the expert doctor didn't know what she was talking about. I saw that, I watched that, and I just want to let you know that I will have your back always for your expertise, Dr. Ferrer. So thank you for all of the work that you do. You've really kept our community and, having true conversations of what it means to focus on the public health. So, as a council member for the 6th District, a district powered by working class families and essential workers, I'm honored today to uplift this new Office of Worker Health and Safety within the county's Department of Public Health. This new office represents a long overdue commitment to protecting the workers who are the backbone of our economy. Too many of them, especially immigrants, low-wage earners, Black and Latino workers, have been left vulnerable and preventable to public health threats because of where they work, how they're treated, and what protections are or are not in place. And of course, the inability of knowing that they deserve better and deserve more. We saw this clearly during the pandemic, and we know that those inequalities didn't start there, and they also didn't end there as well. So we have to continue the work, and this office is exactly that. We also know that health doesn't begin in a doctor's office. It begins in the environments where we live and work. And yet, many working people face structural barriers to staying healthy because of the safety on the job. They don't necessarily know that they have the ability to have a sick day. A lot of workers sometimes feel like that's just not something that they have, right? They also don't know about how to speak up about the environmental hazards. And with their limited healthcare access, things tend to just spiral out of control. But we're hoping that with this office, that's the beginning of some change. That is why this office matters. It says that we are listening to the community. It says that we are listening to organizers, right? It shows that we are listening to the work that has been happening over the last years and, the data that we've accumulated over the last generations to prove its need. So we're here to build a more just, worker-informed public health system, one rooted in equity, accountability, and care. So as we recognize National Public Health Week from April 7th to the 13th, let's remember that investing in worker health is an investment in public health, and public health is important for everyone, regardless of whether you are a working class individual all the way up to those very high earners, because germs don't discriminate, right? So I do also know, I want to thank all of the organizers for coming into CD6. I know that CD6 and the San Fernando Valley has recently been getting a lot more attention as it pertains to worker health and safety, because we finally had LA Times do an article on silicosis. So now everybody wants to talk about silicosis. I vividly remember the day that I saw that article, and I made 2 phone calls. 2 phone calls were very important for me to make. One, I had to call my local environmental justice organization, Pacoima Beautiful, and I also had to call the brick and cement masons to see what they were doing to directly connect with the workers. And, I got to admit, the executive director of Pacoima Beautiful, who a lot of people know I am related to, my oldest sister, right, who is like my mama number 2, we were having deja vus, remembering our work when we were working on the Club Green Up campaign. And as the San Fernando Valley, there were some carve-outs, right? With some carve-outs related in Wilmington related to oil, and in the San Fernando Valley, there was carve-outs related to cutting cement, to cutting granite, right? And it was because it was just not known anywhere else. But we were having deja vus as we were seeing all of these newscasts and all of these reports show the conditions of the workers. And it's like to walk those. We walked those streets. We saw that. We've been knowing this. But now that the press is talking about it, we're, awkwardly, it was like a weird excitement that it was getting the attention that it deserved. And I'm glad everybody else is also talking about it. Because when anybody remodels their kitchen on the west side or the more wealthier parts of the Los Angeles region, chances are that it was probably cut up, manufactured, and put together in the Northeast San Fernando Valley before their beautiful restrooms and backyards and kitchens were what they look like today, right? So I bring this up because I want to thank the Department of Public Health for prioritizing now this workforce, a workforce that for too long was just something that was sitting on the minds of those who fight for environmental justice, but really didn't understand the workforce that is so central and so prominent in the San Fernando Valley. I'm glad they're being brought now to the table because they weren't originally. So again, thank you. I'm glad that this office is now here to stay. And I'll work hard to make sure that it doesn't go away. And if everything is methodical, you pilot, you make it happen, and then it stays. So let's continue to support it, and let's always make sure that the county prioritizes its existence. Thank you so much for having me. And welcome to the 6th District. Can I say a few things in Spanish? Okay, I'll do this very quickly. So, muchas gracias a todos por estar aquí. Bienvenidos al Distrito 6. Yo estoy aquí muy feliz, muy entusiasmada que el condado ahora va a tener esta oficina. Esto es una cosa que ya estábamos esperando por mucho tiempo. Y me alegra que vinieron al Distrito 6 porque sé que ahorita mucha atención se le ha estado dando al problema de la silicosis que está haciendo que muchos de nuestros trabajadores en el Valle de San Fernando se nos enfermen. Y yo sé que muchos de los que están aquí ya sabían que esto era un problema, todos los que hemos estado por mucho tiempo, que es la batalla de tener conversaciones sobre lo que es el medio ambiente. Y esta es la primera vez donde yo me siento que por fin se le está dando esa atención que se les merece. Porque cuando yo era una de las originales organizadoras en lo que era la gran póliza muy nueva, muy innovativa, Clean Up, Green Up, donde íbamos a limpiar 3 vecindades de Wilmington, Boyle Heights y Pacoima Sun Valley por lo que ha pasado en la plantación de sus áreas, que íbamos a ahora cuando se renuevan los permisos, que hagan cosas que mitiguen sus impactos, como que era una conversación al lado, lo que era el silicosis y eran los trabajadores que trabajaban en eso. Pero ahora ya está ganando la atención que se les merece. Muchas felicitaciones a todos los que han peleado para que esto se haga una realidad. Muchas felicitaciones a Alice, porque ella ha sido alguien que ha empezado como organizadora en lo más básico de esta conversación y ahora va a ser la encargada. Y es porque siempre se involucró y nunca dejó que esas conversaciones se fueran nomás para lado. Y yo le tengo mucho respeto, le tengo mucha admiración y muchas gracias porque siempre me ha dado a mí también mi lugar y mi respeto como organizadora. Que a veces cuando alguien trabaja en el Valle de San Fernando, no nos ven igual como organizadores. Muchas gracias y a todos los que están aquí, gracias por su tiempo, su educación y su pasión y pa'lante, mi gente. Adiós.
All good. I'll hold it for now. Yeah, thank you, Councilmember Padilla. As you shared, now more than ever, we need to prioritize the health and well-being of our workers in our city and our county. Now I want to welcome up LA City Councilmember Hugo Soto Martinez, representing City District 13. Hugo Soto Martinez was born and raised in Los Angeles. His parents immigrated here and worked as street vendors for most of his life to give Hugo and his 5 siblings more opportunities than they had in Mexico. After his dad became disabled, Hugo started working at non-union hotels at the age of 16 to help out his family. Shortly before graduating college, he joined his coworkers to form a union, earning better working conditions and respect on their job. Hugo spent the last 16 years at Unite Here, organizing with mostly immigrant women in the hotel industry to win healthcare, higher wages, and anti-harassment policies. I'd like to invite Hugo up.
There we go. Thank you so much. Thank you so much, Cipriano, for emceeing this event and for your kind words. And good morning to everyone. Buenos días a todos. Los que están en el sol, lo siento mucho. For those who are in the sun, I apologize. But first of all, let me just take this moment of privilege and say thank you, Councilwoman Padilla, for having me here in your district. You know, we're good partners on council, and being here in your backyard is always a good thing to travel up to the valley. But I also want to thank Alice Berliner for your amazing leadership. I know we crossed paths many times at Lane, never to work together, but I'm not surprised that a Lane alum is leading such amazing work in the county. So please give her a huge round of applause. And of course, to one of my most and famous constituents, Dr. Ferrer, who we crossed paths many times at EMO Stadium. She gets all the recognition. She goes on the big screen, and the council member for the 13th gets no love. But that's okay. You're a rock star, and we appreciate everything you do. And what a momentous time to be here today. You know, it's not often when we get to celebrate something new, something innovative, or celebrate. This work oftentimes is very arduous, long-term planning, and we do so much. But today, it should be a day of celebration. And joining us in the celebration should be all the workers from the different organizations that are here. I see the Carwacheros, Kiwa, Filipino Worker Center, EDEPSCA, and so many more. Dr. Ferrer mentioned them earlier. And you should be celebrating today because much of the vision and the policy making was informed by your own lived experiences, the things that you go through every single day, which is a great example, as the Councilwoman Padilla mentioned, of real life experiences going all the way through the levels of government, through academia, and eventually being implemented at the level of government. This is what we should be doing all across the country, and it's a great example of what we can do here in the county. Now, as many of you know, as Cipriano mentioned, I spent 7 years in a non-union hotel and 16 years with Unite Here Local 11, organizing workers who did not have a union, because we know that when having a union, it's life-changing. It is life-changing for many workers. But when you experience and talk to those workers, you recognize that they're going through many different issues, such as wage theft, harassment, working off the clock, working with hazardous materials. And oftentimes, we focus on remedying those issues through a union contract or through filing complaints with the county. But oftentimes, those issues are just focused on just making the worker whole through wages or treatment. But what oftentimes is ignored, and which makes me very inspired to be here today, is the issues that surround the person around their public health. Public health should not be ignored when we talk about a worker's life experiences. And so what we're doing here is really looking to the worker as a whole. We don't compromise on wages, health cares, and pensions, but oftentimes we do compromise in a person's health. And as I was reading, as my bio was read, it made me think about my own dad. He stopped working because of his health issues. There's no wage theft to be remedied, but his health was the thing that stopped him from eventually working. And we've heard the testimonies of the Councilwoman Padilla, of people here working and being exposed to silicosis. We ignore that. We've heard stories of people working through COVID. We ignore that. And so I think this is really going to be the intersection of public health and workers' rights. And for that, we should be celebrating today. But we know that creating an office is just the beginning. We must make sure we were vigilant, that we fund it, and that we uplift every single work so that the public knows exactly what this office is going to do. Spreading the word, empowering folks, teaching them how to navigate these systems is going to be just as important. Having examples of victories that are collaborations between nonprofits in the county, it's also going to be important. And so the work starts today. There's a lot of work that was here, but now we got to make sure that this is successful, because we oftentimes know that when we don't make something successful, 5 years, 10 years from now, they're going to be looking at what departments don't need to be funded, and this could be one that we look at. So let's make sure we make this successful, and I know there's going to be a lot of collaboration with the different partners here. I know our city staff will be working, Councilmember Padilla and I will be working, and make sure that this is the best version that it can be. And again, thank you so much for everyone who was part of this, Dr. Ferrer, Alice, and everyone who put this together. Thank you so much for inviting me.
Thank you, Councilmember Soto Martinez. We're grateful to have two of our local leaders here, both of whom with roots in the Los Angeles City labor movement, to help us bring light to why this office is so important. So we're going to hear from several of our partner organizations who, as we've mentioned, right, and we've lifted up that work, that this is why this office is so important, right? They're the foundation of the Office of Worker Health and Safety. So first, addressing the impact of recent wildfires on workers in Los Angeles County, I'd love to bring Chancey Morturell, Director of the Thai Community Development Center, to the mic, please.
Thank you so much, Cipriano. Thank you. I think it's still morning, so I'll say good morning. Again, my name is Chancey Martrell, Executive Director of the Thai Community Development Center, a division of the Center for Economic Development and Human Rights. I am honored to have been asked to provide some brief remarks on the LA County Department of Public Health launching of the Office of Worker Health and Safety today, presided by LA County Department of Public Health Director, Dr. Barbara Ferrer, and other local leaders, Council Member Padilla, and our very own community's Councilmember Hugo Soto Martinez. Since 1994, or for past 31 years, Thai CDC has been protecting the vulnerable. These include low-wage workers, the undocumented, the housing and food insecure, the medically indigent, low-income seniors, and victims of human trafficking. In fact, I'm a daughter of low-wage immigrant workers who grew up in Pico Union, and an immigrant myself. And my mom actually was a member of HERE, a former hotel worker for Beverly Wilshire Hotel for 40 years. And her health was compromised towards the end because her knees started buckling, having to stand and walk up and down the hotel for 40 years, that she had to get 2 knee replacement surgeries. So there is an intersection between public health and workers' rights. At the beginning of 2025, LA County was devastated by the disaster wildfires in the Palisades and Altadena. Thai CC sprang into action and immediately handed out N95 masks provided to our Public Health Council program funded by the LA County Department of Public Health. We also passed out disaster preparedness guides, water bottles, gift cards, food, first aid kits funded by the California Office of Emergency Services. We held a clinic to serve workers and small businesses displaced by the fires and came to the aid of low seniors experiencing power outages who needed food, first aid kits, flashlights, and help navigating a dark building. As an organization that pioneered the anti-trafficking movement since the El Monte Thai garment slavery case of 1995 and more cases that follow, that was just the tip of the iceberg, sadly. We were also concerned that the disruptions caused by the fires can create conditions leaving displaced individuals and workers vulnerable to trafficking, as there is a demand for a greater than usual workforce now to rebuild the devastated areas as quickly as possible, including debris pickup as well. Preventing human trafficking post-disaster is critical, as studies have shown that up to 30% of workers engaged in recovery, construction, and debris collection had experienced labor trafficking. We discussed this serious issue with our API Human Trafficking Task Force. That was back in January, not too long after the fires, held a press conference with LA County agencies and departments, legal aid organizations, community partners, and city leaders like Councilmember Hugo Soto Martinez in February to raise awareness of human trafficking in post-disaster rebuilding. And last week, a motion introduced by LA County Supervisor Holly Mitchell, whom we worked with, was passed by the Board of Supervisors to prevent trafficking in the aftermath of the fires as LA County engages continually in this recovery effort. Like the motion, and together with Thai Community Development Center and other worker centers, the Office of Worker Health and Safety can also help tackle prevention both through awareness for workers and supporting the county's efforts to impose stronger guidelines for county contractors and those they work with in their supply chain, supporting stronger pipelines for good quality jobs in the recovery process, supporting coordinated responses with departments and grassroots organizations that are community-based who can meet workers where they are and create awareness in a culturally and linguistically inclusive way that reaches all workers, and supporting resources and worker retraining for vulnerable workers at risk of being trafficked or who have fallen victim to human trafficking. There is no doubt that the Office of Worker Health and Safety will only reinforce a comprehensive approach in preventing labor trafficking as it rebuilds and recovers. This Office of Worker Health and Safety will also lay the groundwork for collaborating with worker centers such as our center and our own Thai Worker Center and all the Worker Center here today, Garment Worker Center, Koreatown Immigrant Workers Alliance, Filipino Worker Centers, and all of you here today to achieve significant advantages of scale and benefit from the synergies of Thai sector efforts. Together, we will transcend ethnic lines and organize workers across ethnic lines and service industries in an effort to advance safe, healthy, and just workplace. By investing in the labor and human rights of workers, the Office of Worker Health and Safety proves to be an investment in the welfare and dignity of all workers with an inestimable multiplier effect. As Los Angeles struggles to rebuild from the devastating wildfires, let it be an equitable and just recovery whereby we avoid the pitfall of building as quickly as possible and not ensure checks on environmental and labor protections. As social justice organizations, we must band together to demand a just and equitable recovery, protecting workers, residents, local businesses, and the environment, and build a stronger, more resilient, and sustainable community. Thank you.
Thank you so much, Chansey. So next, we're going to hear from one of our community-based organizations, Pokoima Beautiful, who are supporting silicosis outreach to workers in the engineered stone fabrication industry, a critical occupational health issue impacting workers here in the San Fernando Valley. Please welcome Veronica Padilla Campos, Executive Director of Pokoima Beautiful.
Hello, everybody. Good morning. Yes, still good morning. I am Padilla Campos. I'm the Executive Director, and I am Imelda's sister, one of the oldest, but not the oldest. Pokoima Beautiful is an environmental justice organization. We've been here since the 90s, started with 5 moms that were just really fed up with the trash in our community, that organized to make a difference and clean up our neighborhoods. But in the mid-2000s, as Imelda kind of stole the show with my story, but in the mid-2000s, we were doing outreach with auto dismantlers. And while we were doing the outreach, we came across the stone cutting industry. And we realized that there was very little oversight for this business. We would ask around, hey, should they be doing this? Should they be cutting things this way? Should there be more protection? And we really couldn't find information. So we created this PowerPoint, sort of really homemade PowerPoint presentation on best practices. And we try to get them to listen to things they could do, but to be honest, not a lot of folks opened the doors to us. But then, fast forward 2 years ago, the county reached out to us, and they informed us about silicosis in our community and how so many people were dying. The department educated us on the illness and how rapidly it was destroying the young lives of these workers. So we knew we wanted to help, and we were the right organization to do it. Pokoima Beautiful was more than willing to support in getting information out to workers, families, and their friends. Claudia Vasquez and Maria Cabrera, who's here today, our team members, led this effort. They were going out every day. They were hearing the stories of workers and the challenges. They were telling them about their health challenges, the fear that they felt in potentially be dying soon. You know, hearing this information, they would ask us, are you telling me I'm going to die? That was really hard for them to hear, and they continue to hear these stories. And so also hearing stories about friends that they know had just died. So every day that Maria and Claudia go out and share this information, they are now getting the doors open. Folks are now listening. And it's really great to see that. We've hosted workshops together with the employees. We've distributed information at community events. We've done presentations in various community venues. So not just with the workers, but just anybody that listens. They might have a friend or community or a family member that knows someone that does this work. We've seen that doing the follow-up and visiting these sites has really made a difference. After these 2 years, we see locations now using wet saws, and we see significantly less dust at sites. So this is working. But the problem is not over, and we hope that this department will continue to be there for the workers. We cannot let more community members die this way. It is an essential partnership for DPH and community-based organizations like Pacoima Beautiful and all of us here today to continue to raise awareness about worker safety, particularly concerning silicosis. Thank you to the county for the attention and the work that you have done thus far. Thank you for this partnership that has allowed us to get the message out. And thank you for your leadership in tackling this public health threat and prioritizing our communities. Thank you for having me here today.
Thank you so much, Veronica. Real lasting solutions can only be built when we listen to workers, right, and their experiences and what they know. Their knowledge and courage is invaluable. So it is now our privilege to hear directly from that strength and experience. So please welcome Carmen Gutierrez, an organizer with Clean Car Wash Worker Center, up to the mic.
Hi, good morning, everyone. My name is Carmen Gutierrez. I'm an organizer with the Clean Car Wash Worker Center. Clean is a grassroots worker center that empowers car wash workers to make lasting changes in the car wash industry. Sorry, this is probably more comfortable. With over a decade of history in LA County, Clean fights for the self-determination of immigrant and working class people. Clean's worker base represents the largest, lowest paid, and most vulnerable in a highly exploitative service industry. Car wash workers are typically immigrants who suffer from repeated health and safety violations and retaliation on the job. Some of these include slips, falls, exposure to abrasive chemicals without proper protective equipment, lack of access to water, and handling unsafe, heavy machinery, and many more. Being exposed to these health hazards has resulted in workers dealing with lifelong disabilities and other serious injuries. Clean has participated in the Public Health Council program from its inception. Our organization has been able to strengthen our knowledge when it comes to public health, but most importantly, as it pertains to the health and safety of car wash work at their workplace. Our work has allowed workers to improve workplace conditions through the formation of public health committees and filing formal complaints. Filing complaints is only the beginning of addressing workplace issues. True change requires trust, transparency, and collaboration with the investigating agency. This is one of the strengths of our partnership with the Los Angeles County Department of Public Health. Most recently, I worked with the Public Health Council in Redondo Beach, California, where workers at a car wash were asked to show up to work despite experiencing symptoms and testing positive for COVID. Hearing frustration and concerns from several workers led us to support them in formally reporting this outbreak that affect 11 workers. The disregard from management of their symptoms made the workers feel as if their health and safety were not a priority. Our DPH liaison was instrumental in ensuring that there was swift action taken to address the outbreak and including workers throughout the whole process. I want to give a shout out to our liaison. You want to put your hand up? Cindy, she's amazing. The responsiveness of this partnership truly lifted workers' morale and help solidify their trust in continuing to speak up about health and safety. The ongoing issue of retaliation discourages workers from reporting workplace injuries. Retaliation can take different forms, such as workers being demoted, harassed, or terminated. It can affect workers' income, which can lead to housing insecurity due to the financial instability. There are other barriers that affect retaliated workers in secure employment due to the fact that these empowered workers are considered undesirable to employers who profit from their silence. Now more than ever, we need to continue to bolden our commitment to worker safety, given the ongoing attacks on our immigrant communities. With the launch of the Office of Worker Health and Safety, we will continue to build upon the work of Public Health Council program to ensure that there are really lasting changes for workers all across Los Angeles County. Thank you. Thank you, Cipriano.
Thank you for sharing that story, Carmen. So finally, to speak on the significance of the new office and looking toward the future of worker health and safety in Los Angeles, please let me introduce Victor Sanchez, Executive Director of the Los Angeles Alliance for a New Economy.
Hello, everyone. Thank you. Big appreciation to all of our partners here today. It feels like a reunion, but I also think just speaks to the power of partnership and being able to win the policy that we did with the Public Health Council policy, but also now the creation of this office, which is going to be really important for workers throughout the region. COVID showed the rest of the world what was clear to those of us who have been organizing with workers in our region. Working people are on the front lines. And so they are the experts when it comes to the safety of their workplaces. COVID had a devastating impact on essential workers. By the way, have not stopped being essential just because the pandemic has waned. We lost many people, and it was the anger and drive for change of the fallen's co-workers that helped galvanize and inspire the labor movement to take action. The LA County Federation of Labor and its member unions, the worker centers here, as well as others that aren't, and our community allies helped push for a policy that recognized workers' expertise in keeping themselves and the rest of us safe. We ensured there was an anti-retaliation policy both at the county and at the city level to protect workers who speak out about public health issues from employer retaliation. We created a national model on how to address worker safety and health on the job. The Public Health Councils and the resources from Los Angeles County enabled groups like ours to expand our outreach, to organize vaccine clinics in partnership with DPH and employers, to educate workers about their rights, and to learn from them what was needed on the job to protect us all from COVID. To date, Lane has continued to work with UFCW 770, reaching out to workers without union protections in the grocery and retail sector, packing, and supporting food processing workers who were particularly hard hit. And it's worked. The policy has brought accountability. Look no further than Overhill Farms, who along with their temporary employment agency were fined more than $200,000 because of the Worker Health and Safety Committee's insistence on health and safety violations needing correction. The launch of the Office of Worker Health and Safety will be critical in ensuring that our workers go home to their families healthy and with dignity. This is how we build thriving communities and an economy that works for everyone. So today and every day, we must push to ensure this office has what it needs to continue its transformational work. Beyond resources, continued partnership, continued engagement. We look forward to continuing to work with OWHS and the county to ensure that workers have greater ownership over health and safety conditions of their workplaces. Thank you.
Thank you very much, Victor. And as we come to the end, offer some closing perspectives on today's launch. Please join me in welcoming my colleague Ken Riley, Director of the UCLA Labor and Occupational and Safety Health Program, UCLA LOSH.
Hi, good morning, everybody. Get this this off. Thank you very much, Cipriano. So as Cipriano said, my name is Kevin Riley. I'm director of the UCLA Loesch program. We are a university-based resource for health and safety and worker rights based at UCLA, and very proud to have been a partner in the Public Health Council's program over the last several years, and now a close partner and ally of the new Office of Worker Health and Safety. In closing today, what I thought I would do is just sort of connect all of this back to the significance of the launch of this office during National Public Health Week. You know, the work that this office is slated to carry out is so critically core to the work of public health in general. And I really give tribute to the vision and the leadership of Dr. Ferrer and of Alice in pulling this office together, and also the advocacy of all of the organizations that are here today, because you all understand deeply the connections between worker safety, between worker rights, and broader public health issues. And I feel like that's what this office really represents. It's important to note here that this new office puts LA at the forefront of addressing health and safety issues at a local level. To my knowledge, this is the only office in the country that exists at a county level, the only county that has an Office of Worker Health and Safety. That's a really important thing. And I think one of the things that this office does is it really represents a return to the roots of public health as a field, why we're even here in the first place. Public health got started in the 1800s in response to soaring numbers of injuries and diseases and deaths among industrial working class workers. And it was local health departments at that time that were leading the efforts to address those conditions, the living conditions, working conditions of this new industrial working class. Most health departments abdicated those roles in the 1970s when we got OSHA programs. There was a thinking that OSHA would now deal with all of these issues. And of course, there's a couple problems with that. I mean, one is, as we know, federal and state OSHA programs have never had the capacity and the resources to deal with all the issues in all the different workplaces around the country. The other problem is that by siloing a focus on hazards in a workplace on the factory floor, we're ignoring all the other complex ways that work affects our health, the health of us workers, the health of our families, the health of our communities. And so by bringing this office back into a local health department, it's the opportunity to really draw those connections back in again and to see that work impacts health in so many different ways. So it's really exciting to see this office taking shape. I think the other thing that's really groundbreaking about this initiative is these relationships that the office has with all these worker and community organizations represented here. This makes this program particularly groundbreaking, particularly exciting, and I'm really pleased to be part of these efforts and to continue to support them as we work to really underscore those deep connections between hazards on the job site, between worker rights issues and empowerment issues, and the health of all of our communities. So thank you so much for having me here. I really appreciate the opportunity to speak. And I think with that, I'm going to back over to our MC to wrap us up.
Thank you, Kevin. And thank you to everyone. All of our speakers, all of our council members, all of the organizations present. Thank you so much. Thank you, Alice. Thank you, Dr. Ferrer. So this concludes the formal press conference portion, but we invite you guys to stay and to try to engage in two important follow-up opportunities. First, as you can see on the sides of me, we have the Worker Center Public Health Council work exhibition. So please take some time to explore this self-guided exhibit to showcase the work of our partner organizations. And then second, this is for our media colleagues. So we'll have time for interviews here on the lawn. So from about 12:15 to 12:30, if you want to catch any of our speakers to do a quick one-on-one interview, feel free. So thank you all again. A round of applause for us and all of our work and our collaboration. And thank you all.